When looking at the big picture, we can summarize the issues in vaccine hesitancy and reluctance, and we see a number of societal factors that may be the cause of this. Our history of U.S. policies, where some groups felt that it was their manifest destiny, to some groups in the way of Native Americans and those that were enslaved, where the medical establishment actually used enslaved Black women to develop the specialty of obstetrics and gynecology, where distrust in the government or feeling that I'm from the government, but I'm actually not here to help you, draws suspicion in the society and in our U.S. services that those from the government were actually here to be able to help. Develop distrust in the medical system, from the Tuskegee Institute, syphilis studies, to Arizona tribes who were being studied for diabetes, yet their blood and cells were used for gene mapping, as well as segregationist policy and where Blacks could go for hospitalization, as well as whites could go for hospitalization, and how that affected outcomes in our society. And finally, medically exploitative practices. If you recall, Henrietta Lacks cells continue to live to this day and are able to be bought for up to $10,000 per vial. And companies have made tens of billions of dollars from the use of HeLa cells, but nothing has gone to her family since they found out that her cells were stolen from her in 1973. Although her cells are estimated to have saved over 10 million lives on this planet. The HeLa cells have been to the moon and back. And now, thankfully, Johns Hopkins now works with Henrietta's family to determine how her cells are used. These history of U.S. policies led to child and adult health disparities, from poor rural aspects and access to health care, potential resentment from other groups, for poor pediatric outcomes, low maternal death with African American women 3 times more likely to have higher maternal fetal mortality, even controlling for income than other groups. And the chronic pediatric health diagnoses of rural and urban populations that unfortunately led to negative thoughts regarding both groups. Exposures to racism and stigma, where individual encounters, structural discrimination, and some feeling their rights were violated when looking at the changing U.S. demographics of society and fearful of how that would impact them versus those growing other groups. And that fear was used to dramatize issues on both sides when both groups were actually working and fighting for similar goals. That led to a psychological and biological response, which increased the risk for depression, mental health issues, and substance use issues in some societies, as well as increasing risk of illness and fear and distrust and paranoia of those groups that were considered the other, so that both groups were on the lookout and on high alert, unfortunately expecting something negative to happen in healthcare outcomes and healthcare services, and feeling negative regarding each of those groups as both suffered. So when a medical needs issue occurred, such as COVID-19, recognizing that COVID-19 was real and needing to be able to do something about it, including the resources that we have to prevent the spread and now the COVID-19 vaccine, there were concerns about stigma in healthcare interactions, access, coverage, and implicit bias that we actually saw when initial groups presented to the emergency room with COVID-19 symptoms and were sent home and died alone at home. Primary care access in rural areas, and that was not available. So rural families suffered as well. The distrust and disinformation in the media and our messaging also increased vaccine hesitancy and reluctance, so that if someone felt that it was disinformation, they would refuse to follow up on those recommendations, requests, or the vaccine. And unfortunately, because of that, these factors led to poor health outcomes for all groups involved, with minoritized groups suffering the worst, and now rural groups hesitant and reluctant to look at getting the COVID-19 vaccine from the mixed messaging from groups, and some wanting to use their resources for prevention, while some groups feeling their rights are inconvenienced in keeping others from dying. But until we move from the some and others to we, then we will continue to struggle in this COVID-19 pandemic. We all need to work together. We all need to use the resources to prevent the COVID-19 virus from spreading and creating more deadly variants. And we all need to get vaccinated so we can all start to move past this COVID-19 pandemic.